I'm Caroline Milkai, and this is my medication administration checkoff. My ID. I'm going to scan the room. So I'm going to make sure I have no interruptions or no door to the bedroom would be closed. I am not taking any phone calls, and very minimal conversation with any colleagues that may come in. Only emergent conversation. So the first thing I'm going to do is I'm going to compare my patient order care form with my MAR. I'm going to do the 7 rights. So I would check first for my patient, Jaguar Jones, 417, 6352. He does have an allergy to penicillin, so that is noted on both. Now doing the right drug, which is morphine sulfate, 5 milligrams, IM, every 4 hours, and it has not been given within the last 4 hours. And then PRN pain. So that concludes my need for the care form. I can now take this into the med room and perform hand hygiene. I will first select my drug. So I will take my vial and compare it to my MAR. So it is morphine sulfate. It is not expired. I'm going to show this. I'm now going to do my calculation. So my vial says 10 milligrams per 1 milliliter, and my MAR says I only need 5 milligrams, so I will be doing half a milliliter. So I'm going to put that to the side. Since I'm doing an intramuscular injection, I will be using a 3 milliliter syringe, and I will start by using a blunt cannula to retrieve my medication, and to inject my medication, I will use a 23 gauge needle. So I'm going to start by, again, verifying the time that it has not been given in the last 4 hours. It will be 5 milligrams, and it is morphine sulfate. So I'm going to take out my needle and, not my needle, my syringe and my cannula. I'm going to place that on the side as to not to contaminate. I'm going to clean my vial, going in a circular motion. I'm going to draw back 5 milliliters, or 0.5 milliliters of air. Remove my cap. I'm going to be careful, push in my air and withdraw my medication, making sure there are no air bubbles. Okay, so I'm going to flip this over. I'm going to use the scoop method to recap my blunt cannula. I'm going to remove the cannula and apply my needle. I'm going to create a label. I'm going to put the patient's name, Jaguar Jones, the drug, which is morphine sulfate, and the dose, which is 5 milligrams. So I'm going to place that on my syringe, and then I would ask another nurse to verify this. Before I go to the patient room, I'm going to stay here and I'm going to verify my drug in the syringe with my vial to my MAR. So it is Jaguar Jones, as stated on my label and my MAR. It is a morphine sulfate, and my vial says morphine sulfate. It is 5 milligrams. It is intramuscular. This is an intramuscular needle. It will be given every 4 hours. It has not been given within the last 4 hours, and it is needed for pain. So that is what morphine does. So I am now going to take all 3 of these things with me to the patient room. To slide over. So as I come into the room, I am going, make sure I have everything in view. I'm going to come in the room. I'm going to verify my patient. So this says Jaguar Jones, 417-6352, 6352. And I was checking on both of these. There is an allergy to penicillin. Mr. Jones, do you have any other allergies that I would need to know about? Okay, so there are no other allergies, and I would now perform any pre-assessment I need to do. So I would raise the bed to a working height and lower the side rails. Perform hand hygiene. Don my gloves. And my goggles. I'm now going to, again, verify my drug using the vial, my MAR, and my syringe. So I have morphine sulfate in my syringe, in my vial, and on my vial right here, and on my MAR. It has not been given in the last 4 hours, so it is time. There's 5 milligrams. This is an intramuscular needle, and it is an intramuscular injection, and it is needed for pain. So the next thing I'm going to do is clean the area. From most sterile to least, so I'm going from the center, going in a circular motion, and discarding. So Mr. Jones, I'm going to quickly explain to you the procedure. I will be giving an intramuscular injection into the injection site, which in this case is my injection pad, to help with your pain. So now that I have told him and I have cleaned, I am going to make the injection. So I'm going to take my needle. I'm going to uncap it. I'll show you that it does have 5 milliliters in there and no air bubbles. I'm going to uncap my needle. I'm going to pull the skin away from each other, like pull my fingers apart without touching the center. I'm going to go in at a 90-degree angle, straight down. I'm going to aspirate for blood, no blood, and now I'm going to inject. Still pulling apart on my fingers. Now I'm going to retract the needle and release the skin. I'm now going to dispose of this in my sharps container that I have. And I do not have, I'm not going to recap this needle, but I would normally have a safety to go over it. So dispose of that. I'm now going to assess for any allergic reaction, which I do not see. So I'm going to remove my gloves in a downward fashion and my I'm now going to document. But before I do, I'm going to lower the bed and raise the side rails. I am now going to document that I gave morphine sulfate at 5 milligrams in an intramuscular injection at 4:15, and it was given for pain. So to Mr. Jones. So now I have done the right drug, the right dose, the right route, the right time, the right indication, the right patient, and the right documentation. I am now going to come back to my patient and make sure there is no any indication of pain or any other allergic reaction, and making sure that he handled the procedure well, which I would also document.